Today, I'd like to conclude our series on disparities in healthcare. We've been looking at a study that was done in New York State by the Commonwealth Fund. And they were taking a look at the different aspects of healthcare and looking at what was delivered to different groups and what were the outcomes of that healthcare delivery system, what was good, what was bad about it, and kind of what it says to us about that general question that people have been exploring about systemic racism. Is there something that is systemically racist about our healthcare system? Or is it just something in terms of certain inequities in the system that we can maybe correct? How can we have the best possible healthcare system really for all of our people? And I think that this study points to some possibilities, some areas we have to work on to improve and make our healthcare system much more effective. They've taken a look at some of the different surveys that have been done about healthcare, and they found that more than a third of Black and Latino adults, when they were surveyed, reported that they or a member of their household had faced discrimination in the healthcare system. So this was a response that they made based on their perceptions. Now, was there actual discrimination? Again, one could argue that both ways. But certainly there's a perception that there is some discrimination. Was it caused by lack of health insurance, lack of funds, different perceptions of different healthcare providers about the clients? Um, Again, something interesting to explore there, but at least it gives us an indication that there is a concern by a significant number of those who have been studied. One third is rather a large number. Uh, Now, when you're looking at some of these disparities in health outcomes that we've seen in terms of premature deaths that should not have happened, also births and deaths in terms of maternal care. When you look at those types of things, you say, well, what are some changes that we can work on to make the playing field better, to make it more equitable for everyone? And some of the changes that have been proposed are expanding health insurance coverage. But again, this would be expensive to do. But if healthcare coverage is expanded, if more people have healthcare coverage, they will seek treatment, and hopefully there will be better outcomes for people. They will get the care that they need, and lack of money won't be the issue for them. Uh, Providing more preventative and routine care to people of color. So again, working on preventative care. What are the illnesses in this particular population? How can we work on preventing them? What can we do to make sure that those illnesses do not occur? That would be certainly an important step, along with just routine care that is needed, wellness care that is needed, routine screenings that are needed. All of this would be very important in getting us to a better place with our healthcare system. And finally, investing more in social services. Again, if these services were available, if counseling was available, this would be extremely helpful, obviously, to people. So all of these things very significant, very important, different ways to work on equity within our healthcare system so that these disparities are not really an issue. Uh, Interesting in terms of all of this, looking at the statistics, to look at life expectancy is much lower in communities of color. And the survey looked at two different areas. Garden City, primarily a white area, the life expectancy was 87.4, and then in Hempstead, primarily a minority community, 77.2. So there you see a 10-year gap in terms of life expectancy. And you kind of say to yourself, well, there's got to be something wrong here if there is this large gap in terms of life expectancy. Um, so this data for the Commonwealth Fund was collected in 2019 and 2020. David Radley, a senior scientist at the fund, was a co-author of the report. So this report, when you look at it, says, yes, there are these disparities. It seems that people of a certain minority background don't live as long, don't have as good health outcomes. Uh, and it raises the whole question, is this a systemic problem, or is it a problem of certain inequities that need to be addressed? Um, I think looking at it as a systems aspect is one way of speaking about it. But really, when you focus on the inequities and you make those inequities very specific, well, what are the inequities for this population in terms of these illnesses? And then you can work on them and gradually expand the coverage that's needed. Of course, the downside of this is the funding for it. To expand healthcare coverage costs money, to expand social services costs money. But then when you also look at the negatives involved in the illnesses in terms of, loss of productivity, uh, poor jobs, uh, when you look at all of, and you factor all of that in, you say to yourself, well, maybe economically it would be better to provide the health care for people so that uh, our economy will be able to function in a better way. So I think all of this raises some very important questions for us for that continuing dialogue about justice, about how we can make our society more just, and how we can work on it in very specific and concrete ways.